Hello, and welcome to an at-home information session on nutrition during cancer treatment. During this video, you will receive an introduction on how to eat well during your treatment. We will discuss the importance of fueling your body with the nutrients it needs and give you examples of which foods you should eat more often. You will also learn some tricks to help with appetite loss and to improve food safety. Be sure to watch until the end for some tasty recipe ideas. You may be wondering, why is it important to eat well during your cancer treatment? By eating well, you will be able to better tolerate the side effects of treatment. Proper nutrition helps maintain your strength and weight. It will also give you more energy and a general sense of well-being. Food can help rebuild your tissues and muscles and even help your body fight infection by supporting your immune system. Let's jump right in. When it comes to nourishing your body, here are some general rules to follow. First and foremost, it is important to increase the amount of protein and calories you eat. Your protein and calorie needs are increased during your illness and even more so if you are undergoing chemotherapy or radiotherapy. It's important to maintain your body weight, and you can do this by eating more calories and protein. Protein not only maintains your body weight, but also helps your body to build and repair its cells. Some foods that are rich in protein are cooked eggs, chicken, turkey, meat, fish, and seafood, pasteurized milk products such as cow's milk, yogurt, and cheese, soy products such as soy beverage and tofu, legumes like chickpeas, lentils, and kidney beans, as well as nuts, seeds, nut butters, and hummus. It's important to add protein-rich food to every meal and snack. Here are some tips on how to. Add cheese, chopped eggs, nuts, or seeds to your meals. Consume dairy products more often. Sprinkle wheat germ, nuts, or seeds on your cereal. Make high-protein smoothies, puddings, and desserts. Try high-protein and high-energy bars. And add instant breakfast powder or skim milk powder to milk beverages and desserts. Speak to your dietitian about whey protein powder, meal replacements, and homemade recipes. Besides protein, your body also needs carbohydrates or carbs. Carbohydrates supply the body with the best and quickest source of energy. Carbohydrates can also provide B vitamins, fiber, iron, and other minerals. Carbohydrates can be found in grains, vegetables, and fruit. Some foods that contain grains include whole grain bagels, bread, toast, pita, homemade muffins, cereal, oatmeal, pasta, rice, millet, buckwheat, bulgur, barley, quinoa, and couscous. For fruit, try cantaloupe, mangoes, papayas, oranges, strawberries, and kiwi. For veggies, try lettuce, Swiss chard, spinach, green or yellow beans, baked or boiled potatoes, sweet potatoes, yams, and carrots. You can also try homemade vegetable soup, minestrone, or cream of vegetable soup. Besides protein and carbs, your body also needs fat. Fat can supply calories and is an easy way to maintain or increase your weight. Fat is found in many food sources such as nuts and seeds, nut butters, milk products, avocados, oils, butter, margarine, and mayonnaise. If you notice a decrease in your appetite, here are some tricks. Eat more often and in smaller amounts. Eat high-calorie and high-protein foods. Increase the nutritional content of the foods you eat. You can also talk to your dietitian for help with this. Apart from the food you eat, it is also important to drink plenty of fluids. This will ensure that your body is well hydrated. Fluids can include water, juice, soups, bouillons, milk, ice cream, pudding, and jello. Try to drink at least 6 to 8 cups of fluid per day. During treatment, some patients may develop a weakened immune system. This makes them more susceptible to getting sick. Therefore, food safety is very important. Here are some good tips to avoid foodborne illness. Always keep your hands clean. Wash them well with soap and water. Wash and scrub your fruit and vegetables with clean running water. Cut away bruised areas before peeling or cutting. Thaw frozen foods in the refrigerator or microwave. Avoid thawing them at room temperature. Refrigerate your leftovers within 2 hours of cooking. Be sure to eat them within 2 to 3 days. Remember to check expiry dates. Use separate cutting boards and grocery bags for meat products like fish and poultry than for raw foods like fruit and vegetables. Avoid buying bulk foods since they are more likely to spoil and have a higher risk of carrying bacteria. Avoid buffets, salad bars, and salads prepared in restaurants. Avoid homemade fruit and vegetable preserve. Make sure milk, yogurt, juice, honey, cheese, and eggs are pasteurized and not raw. Avoid deli meats and hot dogs. Instead, go for packaged roast beef, roast chicken, and roast turkey. Avoid fermented goods like miso and tempeh. Ensure that eggs, fish, and seafood are cooked, therefore no sushi and no tartars. Avoid runny eggs like sunny side up or soft boiled. There are certain supplements and foods that you should avoid during your treatment, such as multivitamins, minerals, and antioxidants. Please speak with your oncologist or healthcare provider if you are taking or want to start taking these supplements. During chemotherapy, probiotics are also not recommended in concentrated forms. These include products like BioK, Danactiv, and Activia. This is because your white blood cells and neutrophils may be or become low. This means your body has a low immune system and it is difficult to fight an infection, making you more at risk to get one. You should also avoid natural health products, including herbs. Even if they are labeled natural, this doesn't mean that they are safe. There can be negative interactions with medications and chemotherapy agents. They can affect how your body processes medications. Some foods might increase the strength of a drug, and some might decrease the strength of a drug. There are certain foods that interact with treatments and should be avoided. These include grapefruit, grapefruit juice, Seville oranges, orange marmalade, pomegranate, pomelo, starfruit, green tea, acai berries, pure blueberry juice, and turmeric. Remember to limit your consumption of simple sugars just like you would in any healthy eating pattern. This could include large glasses of juice, white or brown sugars, and syrups. Before concluding this session, I'd like to remind you to speak with your dietitian, nurse, or oncologist if you have a low appetite or if you are having problems eating due to symptoms such as nausea, vomiting, constipation, gas, diarrhea, dry mouth, changes in taste, difficulty chewing, or swallowing. They will provide you with guidelines and ideas to relieve these symptoms. The information in this video was put together through the collaboration of dietitians and professionals in oncology from the St. Mary's Hospital Center, the Jewish General Hospital, the McGill University Health Centre, and the Rossy Cancer Network. If you have any questions or concerns, feel free to contact your hospital's symptom hotline. Thank you for watching, and feel free to stick around for some recipe ideas. Here are 6 simple and tasty recipes that you could do at home. For a tasty treat that's loaded with protein and carbs, try blueberry and banana oatmeal. You'll need oats, cinnamon, peanut or almond butter, frozen blueberries, banana, and seeds such as chia seeds, flax seeds, or pumpkin seeds. Feel free to substitute any of your favorite fruit. Avocado toast is a great way to eat more fat. All you need is bread, a ripe avocado, a hard-boiled egg, salt and pepper, and olive oil. Another tasty meal that's full of nutrients is a taco bowl. To make it, all you need is white or brown rice, salsa, corn, black beans, beef, chicken, or turkey, lettuce, onion, cilantro, and lime. For a simple and refreshing smoothie, try this recipe with soy beverage, pineapple, frozen mango, and banana. Pasta salad is another delicious meal that you can make. All you need is pasta, cheese, cucumbers, cherry tomatoes, sliced black olives, onions, and basil. And finally, try this tasty turkey and pesto sandwich. All you'll need is bread, roasted turkey slices, pesto, tomato, onions, and spinach.